Every day is the perfect day to remind the men in your life about the health issues they face and the importance of addressing them, and really what they can do to take charge of their mental and physical well being. Unfortunately, there's a cultural and media driven expectation for men to be these solid rocks and never show vulnerability, never show any kind of weakness or something that might make them seem like they're not as strong as we want them to be. Well, that notion also translates into men seeking less and less medical care and addressing their health. Well, I'm here to tell you that real men get yearly physicals, they share their feelings, they seek help from mental health professionals, and they really try to stay physically fit as much as possible. But they still don't eat cake and chips all the time. Now, today we're going to highlight some of the conditions that affect men, some of their treatments, some of their symptoms, and really just how do we help our men stay best at their health? We're also going to answer any questions that you have today on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions. I'm Dr. Kamaljit Kaur. I'm a double board certified primary care physician here in Coral Springs, and we're going to talk about men's health today, a very important topic, how it affects men and how we can help them manage it and stay best healthy and stay at their the peak of their physical fitness and mental fitness. So let's get started. Our first question of the day comes from Gauri, and she just reached out to us on our website, allhealthtv.com. Gauri asks, Dr. Kaur, my husband just turned 60 and like a teenager still thinks he's going to live forever. He rarely, if ever, gets physicals and colonoscopies or any other health screenings. What can I do? Well, Gauri, this is not uncommon. A lot of men, in fact, most men think that they're invincible, and we want them to be. So that's great. That's a great mentality to have. But unfortunately, this does happen all too often, and this prevents them from seeking medical care because they think it's a sign of vulnerability or weakness. Before I share some suggestions, let's watch this video from our friends at the Mayo Clinic.
When it comes to health numbers,
everybody has to start somewhere.
And a good somewhere is your doctor's scale, according to internal medicine physician Dr. Vandana Bide.
What is your weight? What is your height? What is your body mass index?
It's also called a BMI. Dr. Bide says a BMI reading can indicate if you're carrying too much body fat.
Are you overweight? Are you obese?
Extra pounds can push up your blood pressure reading, another number you should know. The American Heart Association says yours should be less than 120/80.
And then, of course, there's blood tests that are important.
Dr. Bide says these tests reveal things like a blood glucose level, an indicator of your diabetes risk, and your cholesterol reading, a marker for heart disease. Two more numbers to know and to track with your doctor on a regular basis.
I think it's important for everybody to see their doctor at least once a year.
That was some great information from the Mayo Clinic. Gauri, regarding your husband, I'm going to advise you to do the same thing that I do with my own. I take away his race car toy and keys until he goes for his annual physical every year. Seriously. No, but jokes aside, I think it's really important to emphasize to your husband how important his health is to himself, of course, but also to you and to the rest of your family. It's necessary for them to understand that, and then that helps them motivate to go get their annuals and stay as healthy as possible. Also, the fear of unknown sometimes prevents us from doing things, and letting your husband know what happens during his annual exam might alleviate some of those fears. So letting him know that, your doctor's probably going to give you a physical examination just to make sure everything looks, sounds, and feels the way it should. Probably going to get some blood work done. And then your doctor's probably going to recommend some screenings like colonoscopies. Very, very common. Also, vaccines that might be appropriate for your husband, and other recommendations based on his lifestyle and his risk factors. Speaking of lifestyle, they may even make recommendations for some lifestyle measures like diet and exercise. I hope that helps. Our next question is from Mitch. And Mitch reached out to us through YouTube. Mitch says, "Hi, Dr. Kaur. What are the common causes of erectile dysfunction and what treatment options are available? FYI, I'm asking for a friend." Well, Mitch, you're a really good friend. This is something that's very commonly asked by many men, and it is something that can be a touchy subject as well. But before I discuss, let's watch another video from our friends at the Mayo Clinic.
I'm Dr. John Terrell. I'm a urologist at Baptist Health Fort Smith. Erectile dysfunction is an extremely common condition. It's estimated that about half men will experience erectile dysfunction in their lifetime. It can severely affect quality of life. It also can be a sign of other health issues. It's associated with diabetes, high blood pressure, and can be an early warning sign of heart disease. One of the ways I can treat erectile dysfunction at Baptist Health is with the placement of penile prosthesis. Penile implant has been used for decades to successfully treat erectile dysfunction in men. It has an extremely high patient and partner satisfaction. It can provide a permanent solution to erectile dysfunction. While it can be very uncomfortable to talk about, it is worth having a conversation with your doctor.
So that was some great information. Erectile dysfunction, also known as ED, has been diagnosed in, believe it or not, 10.3 million men in the year 2020 in the United States. However, the incidence of men who have erectile dysfunction is probably way more than that. And the reason that is because men don't generally seek attention for it, mostly because they're embarrassed or they're shy. And because of that, the numbers and the statistics that we have are much lower than what's actually out there. But I would like to encourage your friend and all men to talk to their physician if they're having symptoms of erectile dysfunction or if they have any concerns about it and how they can prevent it, what they need to do to stay healthy. We do understand the physical and emotional toll that ED can have on a man and on his relationships, his marriage, his sexual relationships, and his self-esteem. But as your physicians, we are trained and we are empathetic to this, and we really just want to make you as healthy as possible and help guide you to that. Plus, we have validated treatments now, and they can help you and help your symptoms, and sometimes can even fully resolve them. So, excuse me. As mentioned, always the first step is talk to your physician. Now, let's lay out some causes of ED, and some of them might even surprise you. One of the causes can be heart disease. Then there's clogged vessels. Then there's mental health issues. High blood pressure can also affect it, including some high blood pressure medications. Diabetes is a very common cause of ED that we see nowadays. Obesity can affect it as well, believe it or not. Certain prescription medications, as I mentioned, can also cause ED. Using tobacco, whether it's chewing tobacco or smoking, alcoholism, or any other kind of substance abuse can lead to ED symptoms. And then low testosterone, something that's very commonly known, can also cause erectile dysfunction. Now, this next question kind of is one that keeps you up at night, and it comes from Vernon, who just visited our Facebook page. Thank you so much, Vernon. And Vernon says, "Hi, doctor. I'm something of an insomniac, so I guess this is a sleep question. Can you discuss the importance of sleep for men's health and provide some tips for improving sleep?" Oh, absolutely. I get this question all the time, Vernon, and it's equally in men and in women. It's just something that's very common nowadays. Difficulty sleeping, whether that's difficulty initiating sleep or difficulty maintaining sleep. I know a lot of people that are suffering from this right now. But before I drop some knowledge on you, I'd highly recommend that you talk to your primary care physician about it because there's so many causes of sleep disturbances. You always want to get to the root cause of a problem, and that's how you best treat it. Now, sleep is something that's so important, again, for both men and for women. And even though you might think that, hey, I'm sleeping, my body's at rest, all my systems are shut off, that's actually not true. In fact, you'd be surprised to know that certain internal systems of yours are firing on all cylinders when you're sleeping. You're really not shut off as much as you might think you are. Now, some of these tasks that your body completes while sleeping is one of them is restoring your brain balance. So memory, that helps. Concentration, those are re-energized, rebalanced during sleep mechanisms. Also, sleep is very important in hormone regulation. So some of those hormone regulation pathways take place during sleep as well. And then there's tissue repair, there's restoration of energy. There's so many things that happen in your body. So point is, this is why sleep is so important. And according to the American Academy of Sleep Medicine, adults are supposed to get at least 7 to 9 hours of sleep for optimal health. And most of us probably aren't getting that. I know I'm guilty of it sometimes, but you know what? We really need to do what we can to try to, because sleep is so important. Now, not getting sleep can definitely negatively affect your health. And in many ways, it can affect your mood, your memory, your critical thinking skills, the quality of your sperm. Now we're kind of narrowing it down to how it can affect men. It can negatively affect the quality of your sperm. It can lower your testosterone. And these items can lead to infertility. So as you can see, sleep is so important. Hopefully, these sleep tips that I'm about to list out are going to help, but don't forget to check in with your PCP, Vernon, because like I said, you want to get to the root cause of what's really causing your sleep problems. Now, here are some sleep tips to improve your sleep and improve your health. The number one I'm going to talk about is sticking to a sleep schedule. You really want to be regular with the time you go to bed and then the time you wake up. Yes, even on the weekends. You want to pay attention to what you eat and drink. For instance, caffeine. You want to avoid caffeine in those 3 hours before bedtime. You want to create a restful environment in sleep. Nice, cool, dark, avoid noise, avoid lights, anything that could possibly act as a stimulus to wake you up. You want to limit your daytime naps, because if you're sleeping during the day, your body thinks it doesn't need that much sleep at night, so it's going to disturb that cycle. You want to exercise and include physical activity in your daily routine. The best time to do it is right when you wake up in the morning. Really, really helps with your melatonin cycle as well. And then the most notable one that I discuss with my patients nowadays is managing your stress and your anxiety and your worries, because those can really keep you up at night. Now, in case you missed it the first time, here's another opportunity to find out how you can send in your healthcare questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Now, our next question comes from YouTube, and this one comes from Rajiv. Thank you, Rajiv, for sending this in. He asks, "Hi, Dr. Kaur. I heard what you said earlier about real men taking charge of their physical and mental well-being, and I guess it resonated with me. I'm glad. So here goes. How does testosterone affect men's health, and what are the signs of low testosterone?" Thank you so much for sending this question in. It's a very important question, Rajiv, and I'm so happy that you're taking charge of your own health and really trying to figure things out to keep your health at its best. So before I answer your question, let's check out what the doctors at Mayo Clinic have to say. Yep, it's a Mayo Clinic type of day, guys.
Testosterone is a key male hormone that is responsible for characteristics like hair growth, muscle mass, and deepening of the voice. As men age, testosterone levels gradually decline, particularly over 40.
The main complaint I see as a urologist is a lack of interest in sexual functioning. But fatigue, changes in mental acuity, less stamina, and very often mild degrees of depression are associated with a falling testosterone.
In some cases, infertility can be tied to low testosterone, but presenting these symptoms or traits is not an automatic diagnosis.
Not all men need testosterone. It's very important that this diagnosis is properly made. It's made based upon symptoms, but also the actual blood level, the serum level of testosterone.
When it comes to treating low testosterone, the most common way is a cream applied to the upper arm, but injectable or pill forms of testosterone are also available.
What you should notice is that within 48 to 72 hours of your dosage, that your desire has improved.
That was some great information. Low T, you hear about it all the time now. It's in the news, it's on magazine covers, it's on the radio, it's everywhere. And the last few years have really, really wreaked havoc on everyone physically and mentally, at least to some degree. Now, the stress of the pandemic is likely something that has led to poor lifestyle habits for many people, men included, and this in turn has led to negative health impacts. More stress, less sleep, more unhealthy eating. This is a great formula for reduction in your testosterone levels. But before we proceed, let's begin by outlining what testosterone is. We hear about it all the time, but sometimes we have to stop and think what this does to our body that's positive, so we know that when we're low or when men are low, what to expect and why to expect these symptoms. Now, testosterone is a hormone in the body that is present in higher levels in men than in women, and it has so many functions. It helps regulate a man's libido, his bone mass, his muscle mass. It obviously aids in the production of sperm and even in the production of red blood cells. You'd be surprised, but it has a lot of functions. And just like the video mentioned, as men age, there is a certain degree of decline that we see in testosterone, but not always will a man feel the symptoms at low levels. Sometimes the levels got to get really low in order for you to feel symptoms. But like the video also said, that's not a correlation on whether or not you need replacement or you need treatment. The first thing to do is go get your levels tested, and then if you're having symptoms, then you and your doctor can talk about what the right treatment for you is. Now, if a man's testosterone declines, he may notice symptoms that do relate to the items that I mentioned. Your libido might be low. Usually that's the main cause that makes men come into the office and talk to us about it. The men may also notice less hair on their face, less energy, so they're feeling tired all the time, decreased muscle mass. You're going to the gym, you're lifting weights, you're working out, but you're just not seeing that pump that you're used to when you were 20 or 30. And then your endurance might be reduced. And then let's not forget the mental health impacts of reduced testosterone. As the video mentioned, you can certainly have some degree of depression. There might be even irritability or anxiety. Basically, low T can present in a lot of different ways. And the first course of action, like I said, is to get your levels checked to see if that's really the cause of these symptoms. And then you and your physician can make a plan to treat it safely, because there are side effects of testosterone. So you really want to take it safely. You want to make sure you're being given the right type and the right dosage, and you want to be regularly monitored. Now let's move on to our next question. This one is short and sweet. This one comes to us from Cindy, and Cindy sent it through Facebook. Her question is, what helps memory? Well, I wish I could remember exactly. No, I'm just kidding. So there's a lot of things that can help memory, and then there's a lot of things that can negatively affect memory as well. As mentioned earlier, one of the best things that you can do to improve your memory is getting enough sleep. So at least 7 to 9 hours of restful, uninterrupted sleep on average every night if possible is one of the best ways to improve and maintain your memory. Some of the other tips for improving memory are regular physical exercise. Even just 10 minutes a day helps. So if you don't have time to go for a 30 to 40-minute run, walk, or exercise session, even just doing those 10 minutes is great. Staying mentally active. So crossword puzzles, puzzles in general, board games, anything that involves those critical thinking skills is something that's really going to help you maintain good brain health, mental health, and maintain that memory. Believe it or not, spending time with your loved ones, that definitely helps with memory as well, because it also helps prevent some mental health conditions like depression and anxiety. And then that improves your brain health and your mental health. And then eating healthy, food, good whole foods that have vitamins, micronutrients, minerals, all that really helps in those brain pathways that help to maintain and improve your memory. And then there's stress reduction and meditation. Now, stress, when it's high, that can negatively impact your memory. So on that note, making it low definitely helps. And meditation has also been proven to improve with your memory systems. Now, most importantly, it's very, very critical that you see your primary care physician and you're regularly taking care of those chronic conditions that you may have. Because a lot of chronic conditions, if they are untreated or unmanaged, or if they become complicated, can negatively impact your memory. So you want to make sure that you're staying on top of those as well. Now we have another question that comes to us through our website, allhealthtv.com. And oh, by the way, you should really check out our website because there's a plethora of great information on there. Now, this question is from Latoya, and she says, Dr. Kaur, my husband, Miles, is 60 wonderful. Oh, that's so cute. And he's such a sweet man. But he's probably gained about 25 pounds over the last 4 to 5 months, and I can't get him to eat better or exercise. I'm worried about him having a heart attack and dying in an ambulance like his father did. Oh, I'm so sorry to hear. Latoya would like to know, what lifestyle changes can he make to reduce his risk of heart disease and improve his health? Latoya, thank you so much for reaching out. And I love the fact that you're concerned about your husband. I can totally relate. Sometimes I feel like we got to knock them on the head a little bit and, nudge them to do these healthcare related things. So he's so lucky to have you for that. Now, My first question is, how did he gain this weight in a fairly short amount of time? You always want to get to the root cause. So if you feel like he's gained this weight out of nowhere in a short period of time, then you really want to encourage him to see his primary care physician to get it checked out. Because sure, we can probably recommend methods for weight loss like diet and exercise, eating healthy and all that stuff. But if there's something else that's contributed to his weight gain, then that's what we really want to address to properly manage his weight. So encourage him to talk to his PCP and get it checked out first. Also, I think it would help to motivate him into implementing a healthier lifestyle and improving his health just by letting him know how much you care. Sometimes love really is the answer. It's cheesy, but it's true. So, like I said, just simply talk to him and encourage him to see his PCP. Adopting a healthy lifestyle is definitely key to preventing heart disease. So, exercising regularly, avoiding processed foods, anything that Mother Earth didn't make, try not to eat it. So, eat as healthy as possible, avoiding alcohol and other risky substances. It all really helps tremendously. So, that's probably going to be the first step. Now, we got another question from our Facebook page, and this one comes to us from Lance. And his question is, hi, Dr. Kaur. I've never talked to a female doctor before, so this is a little embarrassing, but my friend was just diagnosed with testicular cancer, and it really got me thinking, how often should men perform self-exams for testicular cancer, and what should they look for during these exams? Thank you for your question, Lance. And it's really a good one. I can't tell you how proud I am of all these men sending in their questions because that means you're taking your healthcare seriously, and that's the first step to optimizing your health. Now, everyone advocating for themselves is wonderful, but you always need a physician to advocate with you as well. So if you're having concerns, always see your doctor first. Now, I'd like to start by saying that testicular cancer is actually one of the most curable solid cancers or tumors that we have, even when it's diagnosed in a late stage. So that being said, some of our major medical societies differ in their recommendations on whether or not a man should be performing a self-exam. So some societies say it's not recommended because there hasn't been enough data to prove that it helps or that it helps prevent one death from the cancer itself. It gets a little complicated. But then we have the American Cancer Society who says that men should be performing a self-exam once a month. So when you're performing this exam, what are you looking for? I'll get into a little bit of the details. Basically, what you want to do is gently roll the scrotum between your fingers, and really you're feeling for any lumps or bumps. And if you notice anything, you want to see your primary care physician or your urologist as soon as possible so you can get it looked at, get it diagnosed, and then get it treated. So always do the screenings if you're comfortable with them and report anything that you find that's unusual. You know your body best. So if you feel like something's off, let us know. Oh, wow. If you've got questions, we've got answers. And just in case you missed it the first few times, here again is how you can send us your healthcare questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So keep those questions coming. I love answering them, and I love knowing that these answers might be helping you guys. So thank you. Now, the next question comes to us from Instagram, and this one is from Kirk. Kirk asks, Dr. Kaur, I've been feeling a little constipated the last couple of weeks, and I'm not sure, but I think I saw some blood in my stool. I'm 41, and I've never had a colonoscopy before. I'm in no rush. But that said, do you think I should schedule one? Okay, so Kirk, this is quite an involved question, but a very important one. And even though I can't diagnose you over the phone or over the television, I really, really want to encourage you to see your PCP about this, because we do take any kind of blood in the stool or when you see blood when you go to the bathroom very seriously. I have some tips, but before I answer your question and get to those tips, here's a video from our good friends at the Cleveland Clinic. That was a great video and with some great information. We've had some great videos from Mayo Clinic and now from Cleveland Clinic as well. Now, there's many reasons for blood in your stool. And like I said, we do take any kind of blood in the stool seriously. So the first thing I'm going to say is please talk to your doctor about it. It could be something as simple as an abrasion of the skin around the anus, or it could be something as drastic as cancer. Whatever it is, you want to get it looked at and get it treated as soon as possible. Now, this is a topic that's very, very important. There's a lot of symptoms of colon cancer that I just want to list really quickly. If you have a change in your bowel habits that came out of nowhere, if you have rectal bleeding or bleeding in the stool, if you have ongoing discomfort in the belly area, like cramps, gas, or pain, any feeling that the bowel doesn't empty all the way, weakness or exhaustion, there's a lot of symptoms. But if you're having blood in the stool, please, please, please go get checked out. Now, this has been great. There's been so many questions, and I hope I've answered them to the best of my ability and helped you guys. As always, we love hearing from you, so please do continue to send